Well, if it did say after, it should say, I mean before, it should say after. After is more important.
Okay, have we been fair before, guys? If we find something on the test like that, have we been fair?
Yes.
Okay then.
Okay.
We'll look at it and move forward.
I don't care. It's after, okay? We're just gonna go after. I'm not gonna play the gang mentality either, okay? So, here's the key. Why is it more important? Why before? What are you gonna do before? What does it make a difference before? Doesn't make, that's what you were saying, it doesn't make a difference, right? After, why do you want to be sure and go to the bathroom after? This side, shush. I don't wanna hear from you anymore, I'm not looking at you anymore. Why? Peter, you answer all the time. Back group, I think you're in the back. Thank you, Peter, though, I do appreciate it. You guys, one of you three, why do you want to go to the bathroom after sex? Evans?
I think to brush any bacteria might be before.
Okay, right, because of the mechanism, bacteria is being milked up through the urethra into the bladder. So that's why you want them to get up. Also, I tease my women, and I said, the kids, my kids always ask, hey mom, why is there a mustard container on the back of our toilet? And I said, oh, I just use that to wash. And they're, you're using it to wash mustard? And I go, it's empty, babes. It's an empty container. All I'm using it for is I put warm water in it and I squirt front to back. I only had one girl.
It's a Perry bottle.
It's a Perry bottle in essence, but it was a mustard bottle. You know, so you have to explain to the kids, 'cause why are you using mustard? I don't know. Why is that?
Mustard again, but.
Okay, so what are the signs and symptoms of UTI? Shush. Back group, how about you, Dylan? Can you pop out at least one sign of UTI? Okay, usually in a UTI you don't have fever. You have a pyelonephritis, you get a fever. But on a regular UTI, unless it's starting to go into pyelonephritis, fever is rare.
Burning.
Burning. Okay, that's better known as what in medicine? Dysuria. How about you, Marie?
Urgency.
Urgency.
Frequency.
Frequency. So you should be able to pop out those three just like that. Dysuria, frequency, urgency, and then a lot of times abdominal pain. If you're going to say abdominal pain, I want you to say suprapubic pain. Abdominal pain is too global. If it's in abdominal pain, we're in big do too, okay? So suprapubic or low back pain. What does their urine look like? This side, be quiet now. What does the urine look like? Cloudy and usually has a little bit of a smell, a change in their smell of that, okay? So, and then we need to be able to address how to do bladder health. We're going to be talking in the homework about endometriosis. So let's go down into the hysterectomy. Guys, you have to have under your belt by nursing 3 a comfortable zone for pre and post-op care, okay? And especially when you come to me, we do a lot of C-sections. So if you're on the L&D side, pre-op care. And this goes for all surgeries. It makes no difference what kind of surgery. So what preoperative care are you going to do for a patient? Okay, you got the consent form. The consent form is for what? No. It is not consent for them.
Is it consent so they understand?
They understand the risk and the benefits of what's going to happen to them. If they don't understand what the risk and benefits are, is it your responsibility, Brooke?
No, if they don't understand, no.
No. So what do you do if they don't understand?
Call the doctor's physician.
Yep, get whoever's gonna be doing the procedure and have them come in and re-explain it, okay? Because if you start re-explaining it and it's not what that surgeon wanted, you're in trouble. Yep, make the surgeon or whoever's doing the procedure do the explaining. So besides that, what are you gonna tell the patient after that? That's the easy part, everybody knows that. What do you need to do after surgery? What do they need to understand to get healthy again? You do that all in the front, right?
All the education.
Yeah, what's the education I wanna give them?
Ambulate.
Yes, early ambulation. We're gonna get you up as soon as possible. You're gonna be in the chair within probably the first 6 hours after.
Cough and deep breathe.
Cough and deep breathe, and along with cough and deep breathe, well, sometimes what do we give them?
Sensitive
A spirometer, and what do we do with the spirometer? Blow or suck?
Suck.
Thank you.
10 times.
Okay. I can't tell you how often I go into a room and I have the patient and they go, are you using your spirometer? Yes. Oh, show me how you're doing it. And I'm going, no, that's the easy way, you gotta go. And then that makes them cough because it gets mixed up with their anesthesia. And what else do we wanna do, especially have anything abdominally or we want them to teach them, you see those things? You gotta pull those all the way through. I'm not gonna go through all of them. You gotta review those, okay? We found there was like a little bit of a weakness on that. Fundamentals showed us that, so be sure to review that. Hysterectomy, what you need to know about a hysterectomy, especially to lay people, you need to ask them the questions, okay? Because there's different types of, in their mind, hysterectomy, right? Did you know that? You talk to a lay person, hysterectomy usually means what? They took all out, what's all?
The uterus, ovaries.
Okay, and fallopian tubes, right. So that's where that consent comes into place. A lot of times it is, and again, research is showing it's better if it's just the uterus that's an issue, just take the uterus out, leave the ovaries, okay? And the reason they wanna leave the ovaries is for what reason? Not this side, please. Douglas, why would you think they would leave ovaries and just take the uterus? What would the purpose of keeping ovaries be?
Keeping production of estrogen.
Uh-huh, and that would prevent what?
Early
Menopause, yeah, surgical induced menopause. So that gives the woman her normal, natural courses of where she's gonna be in her menopause, life, right? And that is beneficial. You know what the risk of keeping ovaries are? Ovarian cancers. While ovarian cancer tends to be a young woman's disease, anytime after 55, for both sides of the fence, male and female, reproductive organs start to develop abnormal tissues, abnormal cells. So they start to develop those risks for cancers. When you looked at your reading, it had a lot of times the risk factor for over 55, right, for cancers, as you're looking at breasts, over 55, then you look at the uterus, over 55, okay? So they need to understand what exactly is being done. There's 2 ways to do before I go on. It's a hysterectomy, but on the surgical permit, it's gonna say what if it's everything. Does anybody know?
Radical.
No, there's no radical. Not total. Total hysterectomy is still the uterus in medicine.
It's a long.
Okay, so they're gonna combine it if they're